Today. Okay. Hi, I am Patty from Community Businesses, and today is March, and it's Endometriosis Awareness Month. And today I've invited Dr. Sherri Greene to come on and talk about this very important chronic condition that women suffer with, that's very debilitating and impacts all aspects of their lives. Let me see if I can get her on. And while we're waiting, you can drop in a chat where you're joining from. Let's see. Okay. Oh, hi. I'm sorry. How are you today?
Good, Patty. It's good to see you. It's good to see you here.
Yeah, thank you.
It
I
worked.
know.
It
I was
worked.
like, I'm not the best at the tech stuff, so.
You did great. You did great.
So I appreciate you taking the time out of your busy day to talk to us today about this endometriosis. And I got involved with it because my daughter, who is 21, was diagnosed in January after years of searching for those answers. And, she got the excision surgery right away within a week. And so that's kind of the really short version of her story. But I know you have a long story. And do you want to share a little bit about that?
Sure, sure. I'm sorry about your daughter and all the young women that go through this. And I had my journey that started very, very early on because my mom was diagnosed with endometriosis early on. So they were always kind of watching me because one of the beliefs is that it is hereditary and it's genetic. And so would get checked very early on by the gynecologist. And I started having bad periods really, really on the very beginning. And I would miss school and I'd have to stay home because heavy bleeding and pain and cramping. And I lived with that for quite a while until I ended up getting, I took birth control for a while. I was placed on that very early on. I was on birth control for about 13 years. And, you know, it it sort of balanced things for a little bit. I still had painful periods and they were still heavy, but maybe a little bit less. So it was working until it stopped working. And then I ended up getting laparoscopic surgery. The bottom line with all this is that conventional medicine doesn't really understand the root cause. And so we're kind of symptom treating like we do in medicine often is we're just, how do we deal with the symptoms? Or we're dealing with someone who's, one of the theories is it's estrogen dominance or it's immune dysregulation. And so basically with endometriosis, it's this inflammatory condition that conventional medicine doesn't understand the root cause. And basically you end up with lesions or pods or adherent, all these types of complications of the lining of the uterus somehow finding its way outside of the uterus onto the ovaries, onto the fallopian tubes, into the colon, around the colon, into the bladder, around the bladder. And this is what causes, in the most severe cases, symptoms that are just debilitating, absolutely debilitating for women. And I really struggled with absolutely debilitating pain for many, many years. And I ended up trying bioidentical hormones. I did so many alternative type of treatments. I changed my diet, just a lot of variety of things. I did a lot of acupuncture at that time. So nothing was really solving it really for me. And so it was many, many years of like getting my cycle at the age of 13 going all the way, through my life, trying different things and having two laparoscopic surgeries. I had a histoscopy at one point, looking around to see why I was cramping the way I was cramping after trying bioidenticals and nothing really resolving for me. So, and that's when in 2015 I ended up meeting Anthony William and gotten some more deeper insights into really what the root cause was and what was going on for me. But the problem for women every month is that things get very swollen, and it's a very small space between the colon, between your uterus, and everything that's packed in there. So every time when you ovulate and when you're menstruating, there's a lot of fluid and there's a lot of swelling that can happen. So for women that have this type of inflammation. So sometimes the cramping can feel like it's intestinal cramping because there is a spasming of the colon that can happen down around the menstrual cycle. So sometimes I remember feeling like I didn't know if, and I got diagnosed early on with irritable bowel syndrome. So sometimes you don't know where this cramping is coming from. Is it the uterus? Is it the colon? Because you end up having all these like bowel issues during that time for a lot of women, and I did as well. You get diarrhea, and sometimes women get constipated, but it's like a mixed bag that goes on. But it's very, very debilitating and complicated. And I did try lots of herbal remedies at the time as well, just to try to help with the pain and the inflammation during that time.
Oh, I know. And I'm on a couple of different Facebook groups that I joined once my, daughter had this condition, and just to understand, what is out there, what's being said, what are they doing? Because I know my daughter's doctor put her on Orlissa.
Yeah.
And there were and birth control pills. And I just had so many red flags, shooting up with the Orlissa, for the one, you have to have the bone density scan before they'll even give it to you. And then they have to monitor that. I'm like, okay, red flag number one, it's all just so scary. But when the person you love isn't ready for alternative medicine, what are some of those things that women can do to relieve some of the pain?
Well, I want to say, all of these, and I understand the hesitancy about using the, gonadotrophin releasing hormone suppressors and agonists and antagonists. And so what they're trying to do is that they think there's an estrogen issue here, right? Because of the cycle. And that's what they're trying to do to help offset the pain and that women experience. So in conventional world, there's not a lot that is I was on anti-inflammatories most of my life to try to manage the pain. So at that time, it was really just Advil or naproxen or any of their NSAIDs or people would do acetaminophen, but for me, that didn't really touch pain for me at all. I got into the place where I did a couple of anti-inflammatory like shots in my butt for pain because the pain was so debilitating.
Yeah.
So we can talk about really understanding more about the root cause, because I think that's really important for women to understand. Because if we could, it's not, there's no double-blind crossover studies or randomized controlled studies on this information yet. And I'll say yet, but when you see symptoms resolve for women, you understand that there is some validity to what is being shared by Anthony William, medical medium, right? So there is a lot out there that you can do. It can take time. But when it comes to pain, first of all, you have to get to the root cause to help resolve the pain. But in the meantime, you can definitely, one of the things that I used a lot of was California poppy. I used a lot of very high dose capsules of California poppy to really help offset the pain. It didn't, my pain was so debilitating that it would take the edge off for me so that I could work, but I still had to do a little bit of anti-inflammatory. But for other women, it does help. So you could use a combination of, first of all, you definitely should be doing red raspberry leaf tea. You could be doing nettle leaf tinctures. You could be doing lemon balm. You could be doing a lot of magnesium. I used warm heat constantly because that would really help with the pain and inflammation in my abdomen and in my lower back. So a warm heating pad or a hot water bottle really can do a lot, believe it or not. It can really, really soothe. It doesn't take everything away, but it's very soothing during, those cramping periods. Does that make sense? So let's talk about the root cause for a second.
Yeah.
So when you understand that the uterus is to produce a baby and to clear out any kind of toxins that may unfold and that we gather from being in this world of toxic chemicals. So a uterus can get filled with pesticides, herbicides, fungicides, perfumes, dioxins, all of these really strong chemicals, heavy metals, and then also pathogens. But what happens is the uterus is always trying to push this debris out. And unfortunately, some of this what happens is it'll go through the uterine lining. And then when there's a pathogen present, so a pathogen can feed on some of these poisons and byproducts. And then it forms like a protective little pod or a cyst. And that's where these can escape outside of the uterine lining and go to different areas outside the reproductive system and cause havoc. So it could cause cysts and lesions outside of the uterus, but it can also cause lesions around the colon, inside the colon, the bladder, and inside and outside the bladder. So it really has to have pathogen involved, which could be one of the herpetic viruses, and then it has to do with these toxins. So, and obviously the diet makes a big piece. So when there is eggs and dairy and wheat, these inflammatory type foods that are only inflammatory because the virus is feeding on them, causing more toxic chemicals, toxic byproducts that end up inflaming the nerves, inflaming all the nerves in the area. And that's where pain starts to develop from. So you need these toxins and you need these pathogens to cause these little pods or cysts or adhesions that happen. So when you get to this root cause, obviously alternative medicine doesn't know, conventional medicine doesn't know, but when you get to the understanding of that, that's where you're dealing with the root to stop the fire and the inflammation in that area of the body. Does that make sense?
Yes, that does. That does. Yeah.
Yeah.
And no, go ahead.
Oh, so I was just going to say, the unfortunate thing is we don't have any studies to prove this yet. We only have case studies, anecdotal situations, and my job for me is wanting to catch women earlier than later, be like myself, because what happens is you can go on to having a hysterectomy. You get to that point where you have nothing left and have to do a more advanced type of treatment to be able to resolve the issue. But in essence, it doesn't really resolve the issue because you're still left with the viral piece and the other pathogens. So you could take out the uterus and the fallopian tubes and the ovaries, but it doesn't necessarily ultimately solve that problem. It solves the cramping of the uterus because the uterus is gone, but it doesn't mean that we can't have other issues. And then, of course, there's other issues with the women having, pelvic floor issues and other pelvic issues after having a hysterectomy as well.
Mm-hmm. So do you suggest, I guess it's probably all case dependent, but with the medical medium information and having surgeries, I guess it's all case dependent. Like, would you go to having a surgery or not, or just trying to clean up your diet and clean up and, detox all of that?
Well, it really depends on how advanced the situation is. So everybody's case is different, and it depends on how severe it is and how far along that they've gone, to be able to resolve it. When you catch this early enough, you can do incredible things. Unfortunately, if it goes a long time, it's harder. So for me, it was next to almost impossible to get rid of it because it was so many years for me since being a teenager and just not finding the information till very, very much later on. So I think, we want to get women out of pain. We want to solve this issue before we get to the point that it's debilitating and it's long term. But you can do so much for somebody, even if you're catching it in the first 10 or 15 years, for sure. So there is, and like I said, it really depends on how much toxicity is in the uterus or around the area and what the viral load is and what your state of your liver is. So, conventional medicine says this is all hormonally based. And I say, yes, hormones matter, but it's not the root cause of it, right? So, my feeling is when you catch women who are dealing with these situations, there's always a chance of reversing it and staving off having to get, a hysterectomy for sure.
Mm-hmm. Yeah, they don't know the root cause. That's the problem. And they just throw medications or surgeries as,
They
next
They do.
steps.
They do because they're just looking at like the running conventional theories of root cause are basically they talked about this when I was younger, retrograde menstruation, that the menstrual blood flows backwards up the fallopian tube into the pelvic cavity,
That's what we were told. Yeah.
implanting like endometrial cells. It's just not true, so why would there be a retrograde menstruation? Like if we just ask why and we stay curious about some of these ideas that they're talking about, which are theories that have never been proven. Nothing has been proven. And even conventional medicine will say that. Like there is these treatments are just symptoms and not the cure. But all of these things are not, none of them are proven because they were going to say, we don't know what causes endometriosis.
Mm-hmm. Mm-hmm.
Yeah. So the bottom line is they look to treat the symptoms because the symptoms are so debilitating. They deal with pain. They want to suppress the estrogen, the hormonal imbalance that they think. There's just inflammatory. They call about it, that is chronic inflammation or endocrine disrupting chemicals. We know those are there. They talk about toxins, but nothing has been proven at this point.
Yeah, and with the Orlissa, it's just, what's next? They said that she could only be on it for 2 years.
Correct. You can only be on
What's the next steps then?
Well, the next steps is really to maybe have her being open to saying, well, you can work on these alternative ideas even when you're doing conventional. It's okay. You can.
Mm-hmm.
So you still work on knocking down that viral load. You still work on cleansing to get rid of the toxins out of the uterus and out of the area. And you can do that while you're doing conventional medicine as well.
Mm-hmm. Yeah, I've seen a lot of women on the Facebook groups that just eliminate gluten from their diet and they feel so much better with their pain.
Yeah,
So
I
that
did
tells you
that.
how inflammatory it is.
Yeah, I did that. I took out eggs and dairy and wheat, and it didn't quite work for me at all. So
Mm-hmm.
it really depends. And some people, like if you stop feeding the pathogen, which is an alternative idea to begin with, but if you stop feeding the pathogen, some of the inflammation is going to go down. So just like people finding medical medium and doing celery juice, and some people get better immediately and some people don't, right?
Mm-hmm. Yeah, just depends on where you're at.
Just depends
Right.
on where you're at. So,
Right.
you know, you could do the whole list of foods that actually support for endometriosis. You could start celery juice, which is a really potent tonic for this, and it gives you the phytochemical inhibitors of this excess abnormal tissue growth. So why not? Like, why not start some of these things even while, if you know, don't necessarily buy into all of it or believe it just yet, you got nothing to lose to try it. Yeah.
Right, right. I try to tell people, because sometimes they're scared by the word medical medium. And
Yeah.
it's really just a lifestyle change, if you think about it like that.
Yeah, it
Um,
is. It's a different approach. It's a different idea. And I always say it would be malpractice if I didn't try something that I thought might help improve somebody. And so my feeling is, yes, it is outside of the box information. I understand that. Being a doctor, I really do understand that. But there are so many things out there that are not scientifically proven as of yet that are helpful. And there's scientifically proven things that are very hurtful for people.
mhm.
So for me, to become an advocate for yourself and to take initiative and try something, it doesn't seem like it could hurt to try it. Yeah, right.
Right. And it's just food, right?
It's
Food
just
has,
food and
right.
herbs and supplements, and what could be wrong? I mean, if you have a list of all these foods like avocados, berries, grapes, kiwis, pitaya, raspberries, strawberries, tomatoes, winter squash, basil, dill, turmeric, sea vegetables, mulberries, persimmons, sage, wild blueberries, broccoli, cauliflower, potatoes, sweet potatoes. These are all foods that are amazing for helping to resolve endometriosis. Now you'd say, oh, how does food, but food used as medicine, we don't know what, we don't have enough research about what all these foods do and the the vast ability that some of these phytonutrients in these foods can help us to heal when used in a therapeutic manner. My feeling is, what could be harmful about doing that, right?
Hmm.
And taking out the foods that cause the problem.
Right, right. And there are so many different alternatives that women are getting into, like it was the GLP-1s. I've seen THC, CBD oils,
Yep.
CBG,
Yep.
and I'm
So
sure, yeah,
I was gonna say, the GLP ones are
that's a
huge right
hot
now.
new topic, right?
Hot topic, hot topic.
Yes.
And so the reason why people are kind of, there's nothing proven about GLP ones helping endometriosis. Basically, what they're talking about is this anti-inflammatory effects that
Mhm.
the GLP ones supposedly have. Um, so that they're talking about this anti-fibrotic effect in other tissue models. So these are some research that are out there right now. They talk about preliminary research suggests GLP-1 pathways may enhance progesterone receptor responsiveness, which is central to hormone therapies for endometriosis. So there are a lot of theories again. There's also, they talk about the GLP-1s improving insulin sensitivity, reducing visceral fat. So they're talking about how that can influence the estrogen production. So there's so many different ideas, but they're exploratory. There's no clinical evidence. And honestly, one of the things that they're talking about that it could worsen, the GLP-1s could also worsen the GI symptoms. They could cause more constipation and bloating, which overlaps with endometriosis type symptoms. And it can also affect the gastric emptying, which can interfere with oral contraceptives as well. So, there's so many things that are unknown. And then you're talking about the GLP-1s having more side effects, adding more side effects to somebody who's already riddled with pain. So,
Mhm.
yeah.
Yeah.
So the thing is, if you get on the right supplements, and you work with somebody who knows how to help you with this, and you get medical medium information and start to educate yourself in what's the wealth of information in these books, and you can start to chip away at this. Now, I know not everybody is open right away, but work with a practitioner who's maybe, more familiar with this and can help you make sense of the science and the stuff that's not scientifically proven just yet.
Mm-hmm. So what are some of the early signs, do you think, for endometriosis? I know for my daughter, when right out of the gate, when she started her period, she was cramping a lot. But as a mom, I went through the same thing, and I thought, okay, this is just normal. I just thought it was normal. But then it just started progressing into having periods that would last 2 weeks at a time, and that's when our journey kind of started, way back then. But I know another person that did have endometriosis when she first started her period, and having all that pain, and it took her 20 years to actually get a diagnosis.
Yeah.
And by then she was in stage 4, and it was she had to get her bladder, her bowels reconstructed, and just it just makes a mess of the insides, right? And
it really does. And so the diagnosis part is really complicated at times, because you can't always see these lesions until you go in intraoperatively. So the gold standard for diagnosis is a laparoscopic procedure where you have to go in and visibly see what's going on in there, because MRI won't capture it, or an ultrasound, unless it's a big endometrial tumor. So you won't be able to see those lesions. So you're going on symptoms. So the main symptoms are pelvic pain, either before or during menstruation. There's heavy bleeding. There's it can be irregular bleeding. There's painful intercourse. There's pain with bowel movements during menstruation. There's chronic low back pain, and then sometimes there's fatigue. So those are usually signs, and sometimes IBS like as well. So you don't know, so for me, when somebody starts off with painful periods, it's the first time you start to address it, and you start to deal with a woman who's dealing with painful periods and heavy menstrual bleeding. So whether there is endometrial tissue sloughing off outside the uterus or not, at the beginning, you can address it right off the bat. If you're working with this type of theory, if you're working with the understanding that there's pathogens and there's toxins in the uterus, you could start working on this and never let it to get to a more advanced case.
Yeah, I hope women are empowered to, take in this information, even if it's a little bit of the information.
Yeah.
And
so I wasn't diagnosed till I had my first laparoscopic surgery either. And I had all the painful periods, and what they usually do right off the bat is they give you the birth control. But I was watched and thought I had endometriosis. We didn't know definitively because my mom had it.
Mm-hmm.
So that's basically the pathway that I went down. So I was on it, but I wasn't on it in the way that I would know to be on it now.
Yeah, today. Yeah, you went off with what you knew with your mom. She had the experience.
Correct.
Wow. Right.
Yeah. So there's a lot you can do preventatively right out of the gate, right? If you want. And not everybody wants, and then sometimes they get diagnosed, but you can still work on this and make a lot of headway.
Mm-hmm. Right. That's the power of the information.
Yeah.
Of medical medium, because it can be, so many other things. Women's health. That is just, wow, it would be great just to have one book of women's health.
Wouldn't it be? Wouldn't it be
We're
really
so
great?
complicated, you know?
We are. We're a little more targeted and we are complicated. And I would say, there's so much in all of all of these books out there right now. There's so much information to pick up and start to work on. And when it gets really too much or you're overwhelmed or you're complicated, then there's always people to work with.
Right, right. So how can how do you help women in your practice deal with this chronic condition or other conditions for women's health?
Yeah,
I'm sure you
absolutely.
see a lot, right?
I do. I see a
Yeah.
lot. Unfortunately, I see too much, more than I've ever imagined over the years. I've been in practice over 33 years now, and I've really seen chronic illness personally skyrocket like I never have.
Mhm.
Lots of cancer patients right now, and lots of different complex, very, very complex. Nobody walks in with 3 or 5 symptoms anymore. They walk in with 10 or 15 or 20 different symptoms, and they've been from doctor to doctor to doctor to practitioner. And they've really tried really, really hard, and they've hit a wall, kind of like I hit a wall at that time as well. And so a lot of people do find this information, and they do find my practice. And so I do basically a comprehensive, intake with people, and I do, a food journal, and we do I look at people's diagnostics and blood work, and we do other testing as we need it. And we just kind of work on finding the root cause for people and chipping away and looking at, most people have a lot of different things going on, more than one pathogen, a lot of complicating factors, and we just work at what's priority, and we start peeling away the layers to help somebody find um, the information and applying it in their life in the way that they can. Some people go all in. Some people have to go really baby steps. Some people are more sensitive than others. And there's all kinds of concerns that people have. So I don't work with just one type of chronic illness. I feel like
Mhm.
it's a lot. It's a lot. I see a lot of themes. Like I definitely work a lot with UTIs, and I work a lot with reproductive issues, and I work with sluggish liver issues, which just turn out with so many different conditions. So a lot of hormonal issues for women, and just I work with young adults and teenagers, and with lots of different problems, sleep issues and digestive issues and migraines and you name it. There's just so many topics right now.
There's so much out there, and I feel like probably everybody's walking around with at least one condition they can address, but it's more than that. I feel like just everybody around me has multiple conditions. I could
They,
just tag it in people.
they do. They have multiple conditions, and
Yeah.
some people are not so sick and they're just living with it. And then some people are much more sick. And the thing is that even if you do have to work with a practitioner and you do have to buy supplements and things can get costly, this is preventative medicine. And this is being able to heal yourself without ending up with long-term chronic conditions. So if when you really know how to work with the information and you work with it in a really smart way, you get to heal yourself and enjoy your life. And so it takes time. It's not there are no quick fixes out there, but it does work.
Hmm. And it's investing in yourself, you know. You can get a juicer off of Marketplace if you don't have the money.
Yes.
You can put it through your blender and get it real frothy and put it
Yep.
through the bag and get the pulp out. There's just so many things you can do, but if you think about just that cost, and if you work with a practitioner, some people think that's a lot of money. wait till you have to have a surgery and all
Exactly.
of the cost involved in that and the pain and the suffering.
Exactly.
And gosh, I remember the first ultrasound that my daughter got, and I have insurance, and they referred her to a hospital instead of, a lower cost of service, and it was $1,700.
I believe it.
I mean, just for one test. So I really feel like
Correct.
if you just don't think about all that, and you have to eat anyway, so right? It's kind of
Yeah,
a win-win. And I feel like, along the way, if you're focusing on just one symptom, you'll see other things disappear
you
that
do.
maybe you didn't even focus on. And you're like, oh, that feels better now. It's amazing what you can do for your body.
It truly is. And I can tell you the enormous amount of expenses that I paid with conventional and alternative medicine along the way that
Mhm.
didn't get me answers. Yeah, it's to me, it's very little compared to what you will receive in guidance and information and support. I mean, people do need sometimes more support, and it's really important. I actually have a monthly Q&A that's a very low cost monthly Q&As for $20 that somebody can jump on, and they can get to be with an amazing group of people who come in and ask questions, and they get to learn what everyone else is going through, and they learn from everybody else's question, and it becomes this like empowering community that's really, really, I've so enjoyed hosting them, and they're really powerful communities that are very, very affordable. I also have some free downloads that are available, and I put a lot of content on Instagram. I also have a lot of information on Instagram. You can read about different conditions and about
Mhm.
endometriosis, and so yeah, I just think there's a wealth of information from myself, from other practitioners out there that you can get a lot of healing done.
Yeah, I love all your posts.
Oh,
they're
thank you.
so amazing, and well put
Oh, I
together.
appreciate it. Thank
Yeah,
you.
and the membership groups are what a fantastic idea to be able to be a part of a community, to sit and listen to what others are going through, somebody to relate to, bounce things off of, and that
So
is
important.
incredible, incredible.
And
Yeah.
we have Ask the Docs, which I love, which is for practitioners and non-practitioners. And there's a wealth of information and support. So I think people joining communities is important, especially on this path, because you can feel so alone and so isolated by what you're doing as compared to what maybe the rest of the world is doing. And so to have community, to have friends, to have people to talk to is so vital at this period of time and on the planet, right?
Right, right. And it looks like Johnny Girl says she's joining your QA this weekend.
Yes, she is.
Amazing.
Yes, she is. Happy to have her there for sure. My Q&A is this week. I think we're almost about close, but
Yeah.
it's Wednesday this week. So yeah, but
Yeah.
every month. But I just want to say, as far as endometriosis, and a lot of people who are watching this who may not know enough about alternative, and they're just getting a diagnosis, or they have been diagnosed with endometriosis, you don't have to reject conventional medicine to explore deeper levels, and you don't have to ignore your intuition just because science hasn't caught up yet. For me, I always knew something was not right. Like, it didn't make a lot of sense to me that I was having these debilitating pains, and nothing but nothing was resolving. And I tried so much conventional treatment, and then when I found this other information, I was like, I'd never heard it before, but somehow it made sense. And I know a lot of people have come to me after reading Anthony's books who said the same thing. They read the information and it just made sense. And I think that if you're open to letting yourself be curious and just dive in. And yes, it may come from somebody who's deemed a medical medium and his wisdom, but there's so much truth in these books. For me, when I read through them again and again, I'm blown away always. To me, it's just advanced science that's not discovered.
Right, right. I know I was not accepting answers I got either when I was diagnosed with hypothyroidism. And it's like, no, I'm not going to do this medicine for the rest of my life. I knew there were answers, and, the divine stepped in and dropped medical medium on my lap, basically. So, and yeah, you just start, like I went on his Facebook and I started listening to his lives and reading the comments and going, this stuff is real. People are really healing. And
When did you find this information, Patty?
5 years ago.
Okay, excellent.
And yeah, I got better really quick, actually.
Wow, that's great.
It took me about 6 months only.
Wow.
Everybody is different, but
Yeah, everybody is different. I have people that get better in 3 months. I have people that are still, chugging along at 5 years. So, but things have healed along the way. If there's multiple symptoms, sometimes the symptom you most want to go might not go right off the bat.
Right, right. I had some other things going on and they disappeared. So it's,
Nice.
All related. What you're going through is all related. And the celery, if you do that celery juice and like the morning cleanse is still in my daily routine, just keep on chugging along and you'll just keep cleaning yourself up. Still
Well,
have
I hope your daughter will somehow embrace it at one point. I think if you keep being that example, that maybe she'll want to check it out at one point.
Yeah. So, yeah, I hope this call empowered women to step into their, and just be empowered to take the next step. And even if it's a small step, even if you take a little bit out of this conversation.
Yeah,
And
absolutely. Absolutely. You can always take little baby steps, little pieces, and just, take a shot at it. And you can find me, you can go to my website at drsherrigreene.com, or you can email my office at drsherrigreene@gmail. You can go follow me on Instagram, and happy to support and happy to help these women.
Yes, definitely give Dr. Sherri a follow. She's got great content. And you could always go out to her website and look around. She's got great services. And I appreciate you so much taking the time out of your busy day to talk to us.
Absolutely. And I appreciate you asking me, inviting me on in Endometriosis Month. And, it's obviously something dear to my heart. And I hope that we can make a dent out there. I really do.
Yes. Thank you so much. Appreciate you. Have a great day.
You too.
Okay. Bye-bye.
Bye-bye.